Things that evolve in a practice. For example, cataract surgery evolving into using laser-assisted cataract surgery. A manual microkeratome evolving into using now a femtosecond laser for creating the LASIK flap. LipiFlow, I don't see that same way. I don't see it as the upgrade from something I already have. Instead of evolution, I see this more as revolutionary, in that this is offering a treatment that's addressing the fundamental nature behind the problem and doing so effectively. So I'm really moving it much more into a front line and able to discontinue a lot of the less effective treatments that are not effectively dealing the primary cause. Yeah. You know, who makes up your kind of sweet spot of patients that would really benefit from LipiFlow? Are you going to attract the patient that has been managed by several other doctors ineffectively and may have quite severe disease? Yes, you can help that patient. But again, that's 1 to 2% of your practice. We're talking more about the patients that already exist in your practice. As an extremely busy surgeon operating up to 4 days, sometimes 5 days a week, by definition, I have patients already in my practice that would benefit from LipiFlow. These are patients that would benefit prior to surgery in many cases. These are patients that come back years later and want to know what needs to be done to improve the health of their eye, the quality of their vision. Maybe in some cases it's a YAG laser to open a posterior capsule, but it may also be somebody in need of a better preocular tear film. That's where LipiFlow comes in. To deprioritize the ocular surface and the quality of the tear film. I would submit to you that it is vital to prioritize this in any practice that would call themselves a premium eye care provider. And again, we're looking at this no longer in terms of the dry eye patient not making enough tears. We're seeing this as a need for much greater stability, something that cannot simply be overcome by using all the tears preparations that exist today, the punctal plugs, all those things. Tear film quantity, we cannot add quantity to make up for quality. There will never be an over-the-counter artificial tear preparation that adequately represents what exists in the human tear. And LipiFlow is allowing me to better approach the normal quality of the human tear. Expensive over-the-counter agents, they consist of somewhere between 2 and 6 ingredients. Okay, there's the saline component, there may be the preservative, there may be the component that affects surface tension properties, wettability of the artificial tear, etc. But what is that in comparison to the human tear that has at least hundreds of things we have not yet even discovered? And the things we have discovered have been so complex, including anti-infectious tear lysozyme, growth hormones, hormones that impact the ocular surface. So recognizing that we really would like to improve the quality of our existing tear film. In our busy surgical practices, we have so many distractions, but as I'm taking care of more and more patients, I'm recognizing that I really can't deprioritize the ocular surface and the quality of the preocular tear film and really deliver the kind of care that I feel is essential to what patients expect and what patients deserve. In my many years of undertreating dry eye and the ocular surface, I have to confess it was a somewhat frustrating interaction for both me and the patient, because they were not getting their expectations met. And it became somewhat time-consuming and frustrating for me as I felt that I could better spend my time doing surgery and things I enjoyed more. Now, by integrating LipiFlow very closely to my surgical practice, I see it as just one additional component. It would be analogous now to somebody saying, this patient has a lot of corneal astigmatism, would you consider a toric lens? Well, of course I would, or a limbal relaxing incision. I see it as important as treating astigmatism in a cataract patient is also treating the ocular surface and restoring the tear film with LipiFlow. So the ideal candidate for LipiFlow would really fall into several groups, and I wouldn't say anybody, I'd say there's very few people who aren't candidates, but really the people that I emphasize are people that are about to undergo surgery, that have inspissated glands, people that I'd like to have a better tear film, those that would appreciate a more rapid, successful recovery, those people that I'd feel more comfortable having a normal ocular flora before surgery, people after surgery, people that have had a previous surgical procedure that may have a dry eye. This could be the LASIK patient, the corneal transplant patient, even the cataract patient who at the end of the day is noting fluctuating visions and it may not be entirely an opacified posterior capsule. And really those people that are already in your practice seeing you for a variety of other things, glaucoma patients, for example, that have an ocular surface somewhat compromised by chronic use of glaucoma drops. They're also patients that would benefit from improved quality of the tear film. The nice thing about LipiFlow is really, in my case, the ability to successfully integrate it into my practice, in that it's easy to explain to patients what it does by applying thermal pulsation over a 12-minute period, very successfully opening, in many cases resetting the physiology of those glands. So it's very easy to explain to patients, and they already know what their symptoms are in many cases. So that's the simplistic way of thinking about it. But also there's an elegance to it, in that we're taking a very heterogeneous group and applying it to them because we're addressing the most fundamental nature of their problem. So that's why it's so elegant. It's a simple tool to integrate into the practice, and yet it very elegantly addresses a very complex and very common problem. One of the common perceptions about LipiFlow is the perception of cost price to a patient. And once I show the patient what they're getting, not just the elegance that we previously talked about, but also the precision by which this very comfortable device rests on the surface of the eye, vaulting over the cornea, so not in contact with the cornea, raising the temperature right next to the glands on the inside of the eyelid, not on the outside, which is 6 times the distance from the glands and has all these vessels in between to pull away the heat, but right up against the back of the eyelid, against the glands, heating the glands 10 degrees above core temperature to 108.5 degrees, 16 to 18 degrees above what the eyelid normally sees, and yet raises the temperature of the ocular surface only a fraction of 1 degree, and does this over 12 minutes, applies this temperature across the entire length of the gland with varying degrees of pressure, pulsation, stripping the gland of the material, and then expressing that material from the gland, and explaining to patients that we're turning this Crisco-like material into a Wesson oil that's then able to be removed from the gland, trying to reverse that course of the gland that was heading toward atrophy and dropout, and hopefully recovery of this whole accrued holocrine gland, to a more physiologic state. In a busy clinic where you're seeing 40, 50 plus patients now with electronic medical records, it's become even more complex to see my normal number of patients. And you're running behind, you see a patient who you recognize has some lid margin disease, may not be the optimal timing to talk about LipiFlow. That's where I hand them the brochure and I say, I want you to study up on this. This is in your future. And I feel confident that a very large number of my patients that I see during the day, that applies directly to. In terms of integrating LipiFlow into a busy practice, I would say that as really one of the busiest physicians in the entire medical center, the busiest surgeon at the eye center, I was too busy to not add LipiFlow to my practice. And what I mean by that is, to offer the kind of care that I do, I don't want to do cataract surgery, for example, and not address the patient's diopter and a half astigmatism. Similarly, I don't want to not address their ocular surface, their preocular tear film, the quality of their glands and their lid. So I look at it in that similar vein. I think the best practice for LipiFlow would be the already busy surgical practice. I mean, unless you're one of the unusual dry eye practices, which I don't have. I don't really consider myself a dry eye doctor, but as a very busy clinician and surgeon, by definition, I have several patients that would not only benefit from LipiFlow, but have already demonstrated trust in coming here to me under my care, and I consider it a vital part of their care. In terms of categorizing patients as existing patients versus a new patient, it really depends on why they're there in the first place. I mean, your challenging patients are going to be the occasional dry eye patient who's failed everything, who's there to see you because you do have LipiFlow, and that's the next step in their care. I mean, the good news is you've already known that they've tried everything, that this is the next option, and you're offering the best thing you have available. And so that's somewhat easy in your decision-making process, and fortunately that's a very small single percentage of patients you're going to end up treating. More commonly, it's a patient who's either there for the first time for something unrelated to dry eye, cataract, corneal transplantation, vision correction surgery of some time, contact lens, keratoconus, all of those conditions, glaucoma, or somebody who's already in your practice, somebody who's already had surgery or about to have surgery, especially in a practice that's largely a surgical practice. These patients would very likely benefit from an improved tear film. I'm starting my 4th decade of practicing medicine. I really enjoy providing premium care to patients in all areas, and I consider LipiFlow vital and integral to providing that level of care to each one of my patients.